Hello everyone and welcome to the latest episode of The Doc Is In. My name is Sarah Karaje. I'm the Outpatient Rehab Manager. I have here on my left Samantha Tyler. She works in our inpatient team. And I have Christina Awadullah on my right, who's one of the outpatient physical therapists. In September, we're supporting World Physical Therapy Day. And this day, we're focusing on healthy aging and reducing frailty and falls. So that will be the topic of our conversation today. So Sam, welcome. Who should start exercising?
Well, I think the simple answer is everyone. The benefits of exercise are, very well known. They're well researched. They're well documented. But in reality, it's not quite as simple as that because exercising, I think, can be quite daunting if you've never done it before, if you've never had any sort of exercise routine. If you have chronic conditions, the thought of exercising or exercising itself can be very challenging, or if you've sustained an injury in the past and you haven't quite got back to exercise after that. So simply everyone should be exercising and everyone can exercise. There's no reason why anyone can't, but it's just how you do that and how you modify it depending on your situation.
What do you find, Christina?
Actually, yes, everyone can do, but of course with recommendations, or that's why if the people didn't exercise for a long time or have a break of exercising, they can ask for help from a health practitioner or physiotherapist. They can ask us for help, so we can help them with guidance or program exercises, so they can follow this one, but with a little recommendation according to the health of them, like the health condition.
Yeah. So you're saying there's exercise out there for everyone.
Yes.
We just need to make sure we tailor it to the right
Yes.
person at the right time.
Yeah, absolutely.
Yes.
Okay, great. So, Christina, what are the benefits of exercising?
Actually, it's helping a lot for decreasing the risks of heart diseases, for strokes, for diabetes mellitus, for hypertension. Also, it can give us a good management for the mood, for the sleep. Also, it's helping a lot with the pregnancy, with the pelvic health. Actually, not a lot knowing about that, but it's helping a lot with the pregnancy, the complications actually with the pregnancy. It can help with the gait, the movement, the balance. Some people, they feel like because I'm older, so I have this imbalance. But actually, maybe you will need help to improve the balance, to decrease the risk of the falls. So we're working on that. So we're working on teaching people how to live like a good life with just precautions, but everyone deserves that, to live a good life with the guidance. Yeah.
Great. What about from your point of view, Sam?
Yeah, I think one of the really big things is maintaining independence as you get older. So that's one of the really big benefits. Reduces your risk of falls, as Christina said, and if you do fall, it reduces the risk of the injury being significant that you sustain. It helps with your mood. It helps with your sleep as well. So, you have the physical benefits, but also the mental health and well-being benefits as well from it. And I think it's worth pointing out that there is a difference between physical activity and exercise. And the difference really is that exercise is it's planned, it's structured, it's intentional. But we want people who are 60 and above, we want them to be doing increasing their levels of both. So increasing their overall physical activity, but also implementing exercise and increasing their the amount of exercise that they're doing on a daily basis. So.
Okay, so you talked about different levels of exercise. So what would be a vigorous exercise? What would be an easy exercise for someone, say, 60 years or over?
So the recommendation for everyone, regardless of your age, if you're an adult, is that you do 150 minutes of exercise per week of moderate intensity exercise. Or 75 minutes of vigorous intensity exercise. So that probably doesn't mean much to somebody who hasn't exercised in a while or who's never exercised. So as clinicians, we would work out the difference between moderate and vigorous intensity by doing a calculation with your heart rate. But, for people who are not clinicians, that means nothing. So we actually look at breathlessness and how hard you're working. Using a scale called the perceived rate of exertion. So we get you to rate your breathlessness or how hard you're working on a scale of 0 to 10. And So if you think 0 is you're completely at rest, you're completely relaxed, you're not working hard at all, and then 10 would be you're working exceptionally hard, you almost can't breathe, you're working so hard. So that's the scale we would use for somebody who's starting out. And if you think of a moderate intensity sort of being above 5 or 6 out of 10, and vigorous intensity being sort of 7 plus out of 10. So another way of looking at it would be how, or like whether you can maintain a conversation whilst you're exercising, because it's actually quite difficult if your heart rate is elevated, if you're feeling hot, you're feeling a bit sweaty. To have a conversation whilst you're working at a higher level is actually quite difficult. So to know that you're working at a moderate intensity, you should be able to sustain sort of short sentences whilst talking to somebody, but you wouldn't be able to have an easy conversation. You wouldn't be able to sing a song, for example. But then if you're getting into the sort of the more vigorous intensity exercise, then you might be able to say 1 or 2 words as you're working out, but nothing more. You shouldn't be able to have a conversation. So that's kind of like the guidelines that we would give somebody.
So you want to be a little bit out of breath.
Yeah, for sure.
Yes.
Yeah. What do you feel, Christina?
Actually, it's the same, like what Samantha said. With the moderate, it can be like with limitation also, and it can be according to the case. So which is moderate for me, maybe it's vigorous for you, or the opposite. So that's why it's according to the case itself. So that's why we're doing like tailoring the exercises. I can give you like aerobic exercise. It can be for someone it's very easy, but for the other one this is the maximum. I cannot do more than that. So we're trying to tailor the exercise, or the people should know how to tailor the exercises according to themselves. Like what is the frequency, what is the intensity, what is the type of exercise, what I'm doing. Like if the stairs is one of the goals I need to reach, so I can put this goal for me. Like I will do the moderate exercise, like going up and down the stairs, but with moderate symptoms. Like I have to be like a little breathless, but I can talk, I can speak, like what Samantha said. Like I can say short sentences, but I cannot sing, of course, while walking in up and down the stairs. So it should be people itself, like they should feel what is the symptoms, when I have to stop, when I can continue according to the symptoms that I have. If I felt I'm dizzy, I cannot tolerate more. So that's mean I'm in a little high intensity level of exercise, so I can slow down a little. So that's why this recommendation, it's good for everyone to know. So everyone can do the exercises, but to notice the symptoms that they have.
So you're saying 150 minutes. So if we broke that down, that would be maybe 30 minutes 5 times a week.
Yes.
And you want to be a little bit breathless.
Yes.
So you know you're in that moderate zone.
Yeah.
Okay. Thank you, ladies. So when should I visit a physical therapist?
If anyone didn't started exercises before, if anyone eager to start exercise but don't know what is the starting point from where I can start, or if anyone have like chronic back pain, chronic neck pain, chronic any musculoskeletal injuries or pains that interrupting or bothering in the daily life. If I have surgery, after surgery, when I will start again, if I'm already doing exercises, but after surgery I'm a little afraid of doing exercises again, so maybe I will hurt myself. So it's better to see a physical therapist so they can guide you with this journey. Like you can go again you can keep doing the exercises, but with recommendation according to the case. So if with any medical condition, it's better to ask help from physical therapist. What do you think?
Yeah, no, I agree. Yeah.
And Sam, what would happen in the physical therapy assessment? What would you be testing for?
So we're looking at a range of things. So to start off, we look at your history, we look at any conditions that you may have, any reasons why we might need to be careful with exercise, and we also look at like what's meaningful for you, because exercise, I think most people will agree, it can be really hard to incorporate in your daily routine. People can be busy, and also people don't always like it. So the best way to actually incorporate it is really to do something that is meaningful and that you enjoy, or that you don't completely hate. So looking at, your lifestyle, what you enjoy, what your daily routine looks like, and sort of where we can fit the exercise in and how we can incorporate it without it being too challenging. So That would be the first step. And then we do sort of we call it a battery of assessments. We're looking at things like your strength and your balance and your coordination, your overall endurance for exercise and activity, your risk of falling, all of these things through a number of tests. And then from that, we kind of look at what we need to focus on. So it might be your lower limb strength, it might be your balance on uneven surfaces, it might be your endurance when you're climbing stairs, these types of things. And we put together with you, looking at goals. So, you know, there's no point in me setting your goal for you. It means nothing to you. So what's important to you and how I'm going to help you get there. And we come up together with some goals, and then moving forward with kind of a tailored, individualized plan, looking at what we're focusing on, whether it's strength or endurance or balance or coordination or all of these things.
And what about you, Christina? Because I know you see cardiopulmonary patients,
Yes.
patients maybe who struggle to breathe or have had heart conditions in the past.
Yeah.
Is there anything different that you might do?
Actually, doing like tests especially for the fall risks, because some of the patients, they have a fear of like, I fall before, so I will not walk, or I will not even came out of the couch because I may fall. So we're doing tests for the falls. Like we have different tests for, especially for falls. With the patient, we're using like something called gait belt. We use something like that to give the patient like the confidence. I can walk with the therapist, and I know the therapist will help me with improving my gait. They will help me with decreasing the risk of falls. So we're doing this test, and we always share that with the patient. We're doing this test to know what is your risk for falls. And this is a number for high risk, and this is a low number. So the patient is engaging with the plan, like what Samantha said, like the patient is engaging, like they doing these assessments or these tests to know if I have a risk of fall, so they will take care of that. And with the sessions, we always like motivating the patient to give us the feedback, what you feel, what the exercise that you did outside and you felt like you lost your balance or something. Especially these ones for the cardio and pulmonary patient, we also concentrate with the breathing exercise, especially with the pulmonary patient. Most of us actually don't know how to breathe normally. So it's not like something we should know, but we need to ask for that, because we always like breathe normally, but we know how to breathe correctly to engage our muscles, to take a good amount of oxygen. So most of the pulmonary patient needs to know that. Actually, all of us need to know that, but the pulmonary patient need to concentrate on that. So it will help them, like, I can do exercises, I will not lose my breath.
Thank you, Christina. So as you can see, there are many benefits to exercise, and you've heard it from here. There's no reason why anybody with any age, with any condition, shouldn't be exercising. But if you do need help with exercise, physical therapists are ready to be able to help you with that. Should you feel you need a physical therapy referral, you can always visit your doctor and ask them to refer you for physical therapy. So to finish off, Sam, do you have a final message for our viewers?
I think the message is that anyone can exercise. You know, you basically just have to find a way of starting, and I mean, that's where we're ideally placed, because we're here to support you, to talk you through your concerns, to enable you to do things maybe in an environment with us that you wouldn't feel able or you're not able to do at home. So I guess that's kind of where our skills lie. So yeah, it's never too late to start. I guess that's my message.
Great. How about you, Christina?
Actually, my message is everyone deserves to live a better life. Like everyone, according to all of the things, but it's better to live a good life. Younger or older, anyone can have the good life, and it's better to live our life with feeling like comfortable, and it's an easy life. It's better to it's good to enjoy our life without taking care of these simple things. We can take care of that, and we can guide everyone for that.
Yeah. Great. Thank you so much for joining us.
Thank you.
Thank you.